Super important. So before we jump into this, who can tell me what is validity? Who can tell me what validity is? What are we concerned about when we talk about validity? Don't be scared. Just shout it out. Even if you're off base. What is validity? Any guesses? Okay. So right, remember when we talk about validity, right, we are talking about essentially answering the question, right? How accurate is our instrumentation? How accurate are our measurements? Is the tool, is the instrument that we're utilizing, right? Is the methodology that we're utilizing pure, and is it measuring what it is intending to measure, right? So we're talking about essentially the accuracy of our measurements, right? What about reliability? If something is reliable, right? What does reliability mean?
That it's consistent and that you can do things over and over again and get the same results.
Bingo. Carson, thank you so much for answering that question. Appreciate that. Okay. So obviously we've spent time talking about internal validity. So internal validity relates to the pureness of our methods, right? How accurate are our methods? How pure are our methods? In the sense, how rigorous are our methods, right? And we talked about strategies to enhance our internal validity and minimize confounding factors inside of our studies. Okay. Now, that's internal validity, right? Internal validity is concerned about obviously pureness of methodologies and minimizing confounding factors. But, okay, when we are talking about external validity, we're attempting to answer the question, to what extent can the findings of our study be generalizable to the population as a whole, right? To what extent do they adequately describe and represent the population? So the formal term for that concept, right? To what extent can the findings of a study be generalized or applied to the outside world? Okay, that is defined as ecological validity, right? But the concept of internal validity, it's the exact same thing, right? How are our findings how generalizable are our findings to the population as a whole, right? So obviously, if we have a study, okay, that can be that is done, right, and then is reproduced again with the same findings, right, then that external validity that has a high level of validity and reliability. So internal validity is high, but external validity is also high because that study is replicable, right? We've reproduced the study and gotten the same results. So obviously, one thing that I think makes sense to all of us, right, is that with internal validity, if we do a study in a lab, okay, in a tightly controlled environment, where that is not representative of the everyday world, right, that presents a difficulty. Then can present a difficulty with external validity because it limits the generalizability of our findings, right? Because people do not live their lives in a lab, right? And another difficulty that we often see, many biomedical studies, particularly those that are looking at the effects of new medications and/or therapies, are often first conducted on animals, right? Often rodents, these types of things, and clearly, in experimental settings, particularly with animals, the generalizability of a study performed on animals, the generalizability of that to human populations is very, very limited. Additionally, there can be many, many ethical concerns, right? Particularly in regards to beneficence, right? Putting people in undue harm, right? And ultimately with, uh, you know, animals, rodents, these types of things that are typically used in experimental settings for animal studies. Um, this is maybe a little bit less of a concern, but there are still ethical concerns with animal studies as well. Okay, so a big part of external validity, friends, is replication. Okay, replication, obviously also called reproducibility. Okay, this is a primary concern for the external validity of a study, right? Because it affects how the results can be generalized to the population. Okay, so ultimately, okay, if we have a study that we know, and we've said this before, right? If the study can be replicated across multiple settings and in many different samples, right, then this has a high level of external validity and is easily generalizable to the population, right? So the higher the replicability of the study, the more generalizability that it has, right? And also the more external validity that it has. Now, clearly, right? If we have a study that is reproduced and produces the same findings, that's also really, really important because it's likely that that study hasn't achieved an ideal balance between both internal and external validity. Okay. And so that is obviously rare in the world of most research. But ultimately, studies that are highly reproducible generally have both high internal validity and external validity and have maximized the balance between internal and external validity, right? So when we talk about replication, okay, when we talk about replication, so sorry. Okay, when we talk about the concept of replication, there are two types of replication that we need to keep in mind. Okay, there is direct replication and there is conceptual replication. So with direct replication, right, the question that we're asking is, does the study produce the same results from a different data set, right? They use the exact same methods, right? And I have an example of this on the next slide as well, right? But with conceptual replication, we're asking the question, does the study produce the same results with a different methodology, different settings, or different participants, right? And that's really, really important for observational design studies, which we're going to get into over the next couple weeks. Excuse me. Oops. All right. So here's an example. Okay, direct replication. So direct replication first, right? Let's say that I have a study that I read. I'm interested in a specific problem, and I have a study that I read, and I want to replicate that study. All right. So with direct replication, I'm using the exact same subjects, methodology, and design. Okay. And because, right, I use the exact same subjects, design, and method, or the exact same subjects, design, and methodology, and I produce a new data set, right, uh, from those elements, right? That is direct replication. So that completely and totally replicates the previous study uh, without changing the design. Okay, that is direct replication. So I don't change the design, and I produce a brand new data set. Okay, conversely, okay, conceptual replication. I attempt to replicate a study utilizing a different population, different subjects, with a slightly different methodology, okay, and a different design. Okay, so for example, um, whereas one study may have maybe randomized and blinded participants, in this situation, okay, I am I might randomize, blind, and stratify my data, which is actually a change to my methodology and design, right? Uh, my age group, my subjects might be different. So ultimately, here I am with conceptual replication. I'm changing the subject's methods and design, right? And then essentially producing a new data set. Okay, that is conceptual replication. So an example of this is if I'm trying to study the effects of a disease or a treatment on a different population, right? So I am completely and totally changing the components of the study, okay, uh, studying the same concept, right? But then replicating that same study and asking the same question, only with different subjects, methods, and design elements, okay? And if that's not clear, let me know and we can talk about that some more. Okay, so at the same time, right, even though we know, right, that there's an ideal balance between internal and external validity, and that, the higher the internal validity of a study, generally speaking, the lower internal validity that it possesses. Okay. Um, if it's true, right, that that there is an ideal balance between internal and external validity, right, we can use the exact same tools, okay, to control for internal validity that we can for external validity. So obviously, randomization is one. We talked about that Monday, okay, I believe, when we talked about internal validity. So randomization is obviously a key component, because the more randomization we have in a study, and we talked about with internal validity, that allows us to essentially balance confounding factors across groups, right? But an additional benefit on the side of external validity is that the more randomization is utilized, the more heterogeneity that we have inside of our results, which is then more representative of society as a whole. Okay. So obviously use of different designs such as pre-test, post-test designs, comparing static groups, which is something that's often done potentially in cohort studies, and then quasi-experimental designs, which is what we'll talk about next week and the week after, right? Can be used to control for threats, obviously to external validity, and that we'll talk more about that, right? So, in regards to threats, right, to external validity, we do have four main threats. So we have the effects of testing, right, selection bias, experimental effects, and multiple treatment interference. So we'll talk about that now, right? So interactive effects of testing. Okay, ultimately what this is, okay, this is the presence of a pretest that that makes the participant more sensitive to the upcoming essentially experiment or the treatment, right? And it artificially inflates the results of our treatment. Okay, this is the same thing as a practice effect. All right. So we talked about how, particularly with psychosocial instruments and these types of things, the more that someone has been exposed to an instrument, right, the more experience they have with a test, the more likely it is that they will perform well on that instrument, and that is a practice effect. Okay. Earlier this week as well, we talked about selection bias, right, and we said that selection bias is essentially selection of participants based on specific criteria without randomization. Okay, so we are selecting them because we see something within that group. Pardon me, or that population, right? That could potentially impact the internal validity of our study, right? And we know that obviously can produce an artificial result on the outcome, right? That's not readily generalizable, right? And we talked about, for example, how maybe it doesn't really make a lot of sense to only study hypertension, right? The effects of a new blood pressure medication on an exclusively European American Caucasian population that exercises 3 to 5 times a week, right? We're selecting them because they look healthy, right? And they have good health habits. So it is likely that they will respond obviously more positively to treatment for blood pressure. But then that's also confounded by the fact that they also work out and have a decent diet, right? So it would obviously behoove us to be more heterogeneous in that kind of a study, right? And randomize our population, right, to avoid selection bias. Okay. So obviously, like we just talked about too, experimental effects. Okay. Treatments, the bottom line is that treatments performed in a lab have very limited practical application in the real world, right? And so they're limited in their ability to describe everyday populations of people. Because as we said, okay, as people, we don't live our lives in a lab. Okay. Okay. So multiple treatment interference. Okay. This is another example. Okay. And we'll go back to the example that we just gave with the testing of a new blood pressure medication. Okay. So multiple treatment interference refers to the subsequent effects of multiple treatments on one another, right? So this is where ultimately multiple experimental treatments or levels, right, may confound the ability of the researcher to purely attribute change in the dependent variable to the independent variable. Okay, let's explain that for a second. So let's go back to our example, right? We have a population. We're testing the effects of a new blood pressure medication, right, on obviously blood pressure, right? But as we said, multiple treatment interference. The same population is also working out 3 to 5 times a week, and they limit their sodium. They have a good diet. So we have multiple factors that can impact the outcome of the therapy, right? And so a possible solution to this problem is either, making sure that they are only on the medication with either limited amounts of exercise and or no exercise, or we stratify our groups, right, or within the experimental group to the medication alone or medication plus lifestyle changes, which is diet and exercise. Okay, and we test those two groups separately, right? So that's one way that we can mitigate multiple treatment interference. Okay, that's essentially another way of saying confounding factors. Okay, so obviously, it is possible to achieve an ideal balance between internal and external validity, right? It's hard, but you can do it. So generally speaking, certain research designs attempt to maximize the level of external validity, but often they tend to limit their internal validity, right? And that is a problem with quasi-experimental designs that we'll talk about, right? Pardon me. Well, it's definitely true that quasi-experimental designs can be definitely good, right, and helpful and useful. They often have very low levels of internal validity. So, as we've talked about, right, when attempting to obviously create an ideal study that has a great level of both internal and external validity, trying to randomize, right, focusing on the research setting, and then obviously inclusion and exclusion criteria is extremely important. And randomized controlled trials do this pretty well. And we'll talk about this later, but they are essentially observational studies that still employ obviously randomization, blinding, and obviously inclusion and exclusion criteria. And so, so not to belabor that point, but observational studies have been a great way to address that, right? And so ultimately, we're going to see a lot of that when we talk about epidemiology and epidemiological studies, the differences between incidence and prevalence, right? And testing the effects of obviously a new drug or treatment on a population. And as we've said, usually that's done through a randomized controlled trial. So, okay, you guys, that's it. So I should have the quiz open, by the way, you guys, by this evening. So I'll put up an announcement when it's open, but I will get that up ASAP. Okay. You guys have any questions? Any questions about anything that we've gone over today? Any questions about anything?
When does the quiz close?
Yes, sir. Brevin, thanks for asking. Per the syllabus, that closes Monday night at 11:59 p.m. So you have the weekend and you have Monday. Okay. So that will close Monday at 11:59. If you want to do it over the weekend, that's fantastic. But you have until Monday at 11:59 p.m. What else, friends? Anything else you want to talk about? Okay. All right. Well, guys, if there are no questions, thank you so much. I was telling somebody today how much I enjoy you guys, because I really do. I actually enjoy you. So thank you for being a great class and great people. So I will see you guys Monday. If you need anything, let me know. Okay.
Thank you.
Okay. See you later.
Thank you.
Bye, guys.
Bye.